What have we learned from the research of the past 30 years? There is a large amount we know about how to treat and prevent reading failure. There are techniques that we can use now with confidence. However, we know that timing is critical. We have to go with the right treatments at the right time. We must also recognize that the problems are prevalent and severe. For 40 to 60% of our students, the process of learning to read will be quite difficult. For 20% of our students, it will be the most difficult learning experience they will have in their total K-12 educational experience. During the last 5 to 10 years, our reading research community has become very aware that we must start our educational interventions far earlier. If we are to prevent reading failure, we must recognize that the downward spiral of competence and confidence starts in grade 1. Most of the public school system makes large investments in grade 3. However, the research says that there are substantial decreases in self-concept, in attitude towards reading during the latter half of grade 1. During the latter half of grade 1. That means that if our at-risk students are not successfully engaged in the reading continuum by the middle of grade 1, we have problems. We have serious problems. Then every instructional minute will count. Every minute will count. If, as the research assures us, every minute does count, then we must ask the question, what time is available to us? In the average school day, we have 6 hours of available time. Of that 6 hours, 4 3/4 hours are allocated for instructional time. Of the instructional time, the average student is engaged for 2 hours and 50 minutes. However, being engaged in an instructional task does not mean learning. What time does the student actually spend successfully engaged in important tasks? It's approximately 1 hour. That is, the academic learning time is, on the average, 1 hour per day of the available 6 hours. However, that is only an average. There is massive variability amongst our teachers. Our best teachers provide 3 times as much academic learning time as our least effective teachers. They know and practice a lot about what to teach and how to teach. There can be little doubt one of our highest priorities has to be to increase the academic learning time of students at risk of reading failure, or for those who indeed are already failing in reading. Now, academic learning time is all about selecting the most meaningful tasks to the student and ensuring that students are successfully engaged for the largest amount of time in those meaningful tasks. We must now turn to our research on what are the most important tasks for students at risk of reading failure. For that, we turn to the research we have on the profile of our reading failures. And we know, first, that these students are very evident. They show a very labored approach. They have considerable difficulty in sounding out and identifying unfamiliar words or unknown words. They do not have the decoding procedures to confidently identify words they have never met before. We know, for example, that the poor comprehension evident with many of our at-risk students and our reading failures is due to this labored approach to dealing with words they have never met before. They are spending far too much time trying to identify the word. They do not have the time or the resources to focus on comprehension. The research is very, very clear. Decoding and word recognition difficulties are at the core of most reading difficulties. So, any program to prevent and treat reading failure must recognize that decoding and word recognition is extremely important. Once we are very clear on what we should be teaching, that is, we know what the most meaningful tasks are for these students, then in order to increase academic learning time, we have to then recognize what are the most effective instructional practices. What is the pedagogy? What are the teaching methods? What do our best teachers do consistently? What makes our effective teachers effective? The research tells us a lot about this. We know that our most effective teachers go through the following sequence. They check for the important prerequisite skills. They then introduce new content very carefully. They then move into guided practice. And when they're successful in guided practice, they move into independent practice, and then they make sure that the most important curriculum skills are systematically reviewed to prevent that information fading as time goes on, and to consolidate it. So, in reading, a typical effective classroom will have the most important instructional agent, the teacher, working in the most demanding setting, and that is teaching new content to the most at-risk students. That may look like this. We'll have a small group with the classroom teacher working with a small homogeneous group of students very much in need of careful teaching. Other students may be participating in guided or independent practice with a volunteer or instructional aid. In more extreme situations, we may be working with tutoring. However, the most effective settings are typically the dynamic, homogeneous small group for introducing new content. However, all our resources are important. And so, if we are to capitalize on this sequence, we must look to the home as a source of increasing independent practice. We must look to the summer programs. If every minute counts, then all these resources are important. The teacher has a role, but so will the volunteers, so will the aides, and certainly so will the home. We know that the answers are not, in Robert Slavin's words, exotic or expensive, and we have a choice. We can either leave things as they are, or we can implement what we know and prevent virtually all reading failure. There is a lot of hope. There is a lot of good news in the research. We know that if we do the most effective things at the right time, no child has to fail.